please come forward. This row, please come forward. आइए, आप ही लोगों को बोल रही हूँ.
जल्दी बैठो, जल्दी जल्दी, भागेगा कोई नहीं पीछे से, सारे बैठो, फटाफट बैठो जल्दी.
Please settle down. Muskan, please sit down. Ma'am. Good afternoon, sir. The guest is here, guys. Good afternoon. Good afternoon, everyone. Good afternoon and namaskar, everyone. I am Yashaswika Yadav, Assistant Professor in the Department of Strategic Communication. On behalf of the Indian Institute of Mass Communication, I extend a very warm welcome to all of you to today's Cardiac Health Talk. The Indian Institute of Mass Communication, established in 1965 under the Ministry of Information and Broadcasting, Government of India, is recognized as a premier institute for professional training, education and research in the field of mass communication. Over the years, IIMC has played a pivotal role in shaping communication professionals who serve in diverse sectors. In addition to its campus in New Delhi, the institute has 5 regional centers located in Dhenkanal, Aizwal, Amravati, Jammu and Kottayam, who have joined us through online mode. Health has always been a cornerstone of public awareness, and in today's time, cardiac health has assumed critical importance, even among the younger generation. This talk seeks to shed light on this growing concern and help us understand both preventive and corrective measures. To begin the program, may I request Dr. Meeta Ujjain, Course Director, ADPR, to kindly felicitate our esteemed guest, Dr. Tapan Ghose, Senior Director and Head of Cardiology, Fortis Hospital, Vasant Kunj. It is now my privilege to introduce our distinguished guest. Dr. Tapan Ghose is a highly acclaimed cardiologist with 25 years of experience in the field. He completed his MBBS from Guwahati University, MD in Medicine from Dibrugarh University, and holds a DNB in General Medicine and Cardiology. Dr. Ghose has served in leading hospitals such as Escorts Heart Institute, Fortis, and Paras Hospital, and is currently the Senior Director and Head of Cardiology at Fortis Hospital, Vasant, Kunj. Sir has contributed extensively to medical literature with over 100 publications in national and international journals and 12 book chapters. He is also the author of the Handbook of Lipidology. In recognition of his exemplary contribution, he was awarded Cardiologist of the Year 2014 by the Indian Healthcare Summit. Dr. Ghose is a life member of the Cardiological Society of India and an active participant in international medical forums. His dedication to advancing medical science and patient care makes him a true inspiration for all of us. Dear students, please join me in welcoming Dr. Tapan Ghose to deliver today's health talk. The stage is yours, sir.
Good afternoon, everyone. Thank you for the warm welcome. It's indeed a great pleasure and honor for me to be with you today because it's a great institute and all of us can see that amongst you are the leaders for tomorrow. And I think one of you will be heading some communication institution like Arnab, Sardesai and all. So it's really great privilege to be with you today. So, in coming slides, I will try to make you understand the current situation of cardiovascular disease in the country and what we can do as a common man, what should be our motto to prevent the rising epidemic of our cardiovascular disease in the country. Okay, so this slide shows the problems in our country. If you take the 5 topmost cardiovascular diseases in the country, in both rural and urban population, cardiovascular diseases are the leaders for heart diseases in the country, followed by COPD, asthma, cancer, perinatal mortality, respiratory disorder. By and large, when you are born, chances of dying is maximum with heart disease. If you make a statement that all of us will die from heart disease, you will not be wrong. Okay. So, there are 2 types of heart diseases. One is congenital heart disease or birth defect. Another is acquired heart disease. Now, congenital heart disease is a disease which you acquire at birth, either because of birth defect or a hereditary disorder. Amongst them are, connective tissue disorder, related disorder, conduction system disturbances disorder, or you get cardiomyopathy. That means thickness of the heart muscle is more, or there is some hole inside the heart, either the upper chamber or the lower chamber are intercommunicating. So these are the congenital disorder. That means you get at birth. The commonest cause of heart disease in our country is not the congenital disorder. It is the acquired heart disease. That is, you acquire after birth. What is this? This is called atherosclerotic vascular disease. That means thickening of the arteries or the blockage of the arteries, which occurs because of cholesterol deposits below the arteries. And cholesterol deposits occurs in time-dependent manner. It takes years for development of atherosclerotic vascular disease. When you are born, see, there is no impediment in flow. And when the plaque develops after 10 years of life, it starts developing. By 25 to 30 years, it happens like that in the downward panel. And so, see, this yellow material is the acquired defect, which was not there when you were born. And this, from this to this, takes 20 to 30 years. And this develops if there are risk factors for heart diseases. What are the risk factors for heart diseases? Risk factors for heart diseases are, okay. So I am really, acquainted with my presentation rather than this thing. So there is just to give an idea about the Indian population, what's happening in India. 4 people die every minute in India, 900 deaths every day below the age of 50 years. These below 50 years of deaths are premature deaths. Heart disease should not develop in male population below the age of 55 years. In the ladies, heart disease should not develop less than 65 years of age. If it is occurring earlier, it is there is something wrong and you have missed the train. You have not prevented the heart disease development. And heart disease is more common in Indian population, 6 times higher than Chinese, 20 times higher than Japanese population. So now we know that an ounce of prevention is worth a pound of cure, so that we'll see how to prevent the development of heart disease. Now, some risk factors are modifiable and some are not modifiable. So left side of the screen showing non-modifiable risk factor like ethnicity. Now, Asian Indians, by and large, have higher incidence of vascular disease. This is genetic. And why we don't know, but it's a hypothesis that thripty gene hypothesis or Baker's hypothesis, probably maternal malnutrition is the cause of future heart disease in our country, because our placentas are, lower, placental weight is less, body weight when the baby is born are less, low birth weight babies. As a result, the organ, particularly pancreas, is smaller. So when he is exposed to higher calorie in the adulthood, his atherosclerotic vascular disease develops because it cannot cope up with the genetic programming what he had at birth. So these are the hypotheses. Age. Higher the age, higher is the chances of having a heart disease. By and large, 20 years is the age where you don't have any disease. But for the ladies, till the age of menopause, from early menarche to menopause, they are protected. So heart disease does not develop. After menopause, there is accelerated atherosclerosis and acquired of heart diseases, and then exceeds the main male population. Family history. If you have family history of heart disease, then you are at risk of heart disease. So what do you mean by a family history? As I told you, any male member having heart disease less than 55 years of age, like say your grandfather had heart disease, he had a bypass surgery at 50 years. That means you have a family history of premature heart disease. Or ladies, like your grandma had a heart attack at 60, so less than 65 years, so you are having a heart disease. So for the ladies, it should be 65, for the gentleman it is 55. So anybody, any first degree relatives had any heart disease at premature level, then you are at risk of future heart disease. Then gender. As I told you, ladies are little protected at early age. On the right side, these are the risk factors which are really, modifiable. If you take care of all these risk factors, then you will be able to reduce the incidence of heart disease in our country by 80%. What are they? Sedentary lifestyle, high blood pressure, overweight, diabetes, stress, smoking, high cholesterol. So, the cardiovascular disease is a continuum. Various risk factors, they interplay. Like if you have little high blood pressure, you have 50% chance of having diabetes. Then you develop ventricular hypertrophy that leads to coronary artery disease, myocardial infarction, angina. Or, if you survive that anginal attack or the heart attack, then gradually the heart enlarges and you go to the heart failure stage. So this is the continuum. So one of the factors initiates the event and the cascade continues and it vicious cycle ensures. So hypertension or high blood pressure is very, very important. This is one of the most important and preventable risk factor in our population. So what is hypertension or high blood pressure? Blood pressure should not be more than 120/70. A blood pressure of 120 up to 139 is elevated, also called pre-hypertension. Blood pressure from 71 to 89 is called elevated or pre-hypertension. Blood pressure of 140/90 is high blood pressure. Next slide. So elevated blood pressure 120 to 139, 80 to 89, and blood pressure of 140/90 is high blood pressure. Next. 30% of our population has high blood pressure, and this was a little older data. I'll show you that the current incidence is much more than that. This was our learning. Then the most recent data in 2023, which was published in Lancet Endocrinology from India, has shown higher incidence than this population. Next slide. See the hypertension map. So if you look at the right side of the map, see entire urban population, more than 30% is the incidence of hypertension. And this is the pan-India picture. This is the rural population. So little less, but then by and large it is up to 29%. That means 1/3 of our population at the present moment on all the metros and on their hypertensive, and it is 35%. 35.1% is the incidence of hypertension in urban India, which is really frightening. Why it is frightening? Because this is a single most important cause of stroke in the young, coronary artery disease in the young. Next slide. Yeah. So how does it do? How does it do the harm? First, it does coronary heart disease, blockage in the coronary arteries, then stroke, that means blockage in the brain artery leading to sudden paralysis, then heart failure, and the peripheral arterial disease, blockage in the leg arteries giving pain to the legs on walking. Next slide, please. So the changing trends in hypertension, earlier we used to see blood pressure in the elderly age group, and we used to see more dementia, more heart failure, etc. Now we are seeing more of chronic diseases and more of diseases of systolic heart failure, chronic arrhythmias, kidney diseases. Kidney disease is on the rise in our population. This is single most important cause of kidney disease is high blood pressure. Undetected, untreated hypertension is the important cause of kidney disease in our country. So if you can detect hypertension, treat hypertension properly, then all these diseases are preventable in the general population. Next slide. So you can see the risk. For every 10 millimeter rise in diastolic blood pressure or the lower blood pressure, and for every 20 millimeter mercury rise in upper blood pressure, the risk doubles. I'll give you an example. Say somebody has 110/70 blood pressure, another gentleman has 130/70 blood pressure. Although both of them are normal, the chances of vascular disease is 2 times in the person who has 130. So for every 20 rise in upper pressure or 10 millimeter rise in lower pressure, the risk doubles. And this is in geometric progression, 2 to 4, 4 to 8. It just jumps. So this is very important understanding that the blood pressure rise is paralleling with the incidence of vascular diseases. So what is the benefit? There is enormous benefit. So if you can reduce 10 millimeter mercury pressure, then there is 30% reduction of risk of heart attack, kidney failure, stroke risk. And the reduction in the stroke is much more important than even heart diseases. So if you lower the blood pressure in the population, the chances of stroke decreases, chances of heart attack decreases, and chances of paralytic attack decreases, heart failure incidence decreases, kidney failure decreases. So it is very important to reduce the blood pressure in the population. Next slide. This is again showing in a graphical form what is the benefit. So you can see that heart failure is 52% reduction in heart failure, vascular deaths 21%, 16% reduction in fatal and non-fatal heart disease mortality, stroke 38%. So there is enormous benefit of treating the blood pressure. Next slide. So, you know, if you talk to the senior people, they'll tell that the blood pressure is not very important at my age. Now we have understood that at every time point of life, blood pressure is important, right from the birth. And blood pressure should be measured in the children also, and cholesterol should be also measured in the children also. And this is important to understand that when you are young, at your age, the lower blood pressure is more important, the diastolic blood pressure up to the age of 40 years. Once you cross 40 years, both systolic and diastolic are important. When you cross 60 years, systolic is important because the blood pressure primarily goes systolic. So the behavior, population behavior of blood pressure is like this. In the premature age group, that means younger age group, it is primarily diastolic or the lower blood pressure. In the middle age group, both systolic and diastolic. In the elderly population, only the systolic goes high. So this is the population behavior of blood pressure. Next slide. So how low you can go? Today we know that we can lower the blood pressure significantly. Current aim is to lower the blood pressure by 120 to 129 upper limit, and the lower blood pressure should be less than 80. Next slide. This is showing that blood pressure should be reduced to 130/80 in most of the population. Next slide. What are the other things you can do accepting medicine? These are the charts showing that weight loss. If you lose weight, there is 2 by 3 millimeter less blood pressure if you are not having high blood pressure, the normotensive population. In a hypertension population, there is 5 millimeter decrease in blood pressure. And if you have a good diet, what is a good diet? It's called DASH diet. You can Google it, you will get it. For all of you should know this DASH eating plan. And you should popularize this in your society, in your friend circle. DASH eating plan. DASH. What is that? Dietary approaches to stop hypertension. Largely it is plant-based diet, lot of green leafy vegetables, less salt, and less in oil and more of olive oil kind of stuff. And that diet reduces blood pressure. So even you can see that 11 millimeter mercury reduction in the blood pressure. DASH eating plan. Dietary sodium restriction. Normally we take a lot of salt. Indian population takes a lot of salt because we use a lot of namkeens. We are very fond, and that gives a salt load, and that salt load is not getting excreted to the kidney. And by and large, the water intake of our population is not that much. I don't know why it is, because by and large, the adult population who stays outside, they are stingy on water also. So they take higher salt, less water. As a result, the blood pressure in the population goes high. And, this carries the future risk of heart disease. So dietary sodium should be less than 4.5 gram. So how do you do that? Per head, per day, the common salt consumption should not be more than 1 teaspoon. 1 teaspoon is 5 gram. So if you have 3 person at your house, so for cooking in 24 hours, you should use 3 teaspoonful, 15 gram. So if you have 5 person, 25 gram, 24 hours, that should be there. And you should not take extra salt during eating. Avoidance of extra salt during eating, we call NAS diet, no added salt diet, NAS, NAS diet. That gives you normal salt of intake of 5 gram per day. Then dietary potassium should be increased. Dietary potassium comes from fruits, vegetables, etc. Weight loss, very important. Weight is important for all of us. And what is the normal body weight? Normal body weight is calculated by body mass index, BMI. I come to BMI little later. And weight loss is associated with reduction in blood pressure. Next slide. So dynamic resistance and isometric exercise, both are important. So both, little muscle building exercise and physical activity like brisk walk, cycling, swimming, jogging. Out of these four, you should develop that habit of doing any one of them. Brisk walk, cycling, swimming, jogging. Any one of them you can choose. I can do 20 minutes a day. And resistance exercise at least 3 times a week you should do to keep your muscle strength. Lightweight you should do to keep your upper arms and muscles intact. That gives you a good muscle tone and good muscle health. Next, alcohol consumption should be minimized, and we really don't advocate alcohol consumption because it is associated with higher incidence of stroke in our population. Next. Now, diet. Diet and health are intimately related. We have found the mention of diet in ancient literatures. So in Shraddhatra Vivag Jog, Bhagavan Sri Krishna says about the diet. And Swatikahar is explained. That means 5,000 years ago, our ancestors are aware that if you eat properly, your manifestations will be different. That means in current days genetic terms, if I tell you, if you modify your diet, your phenotype will be different. So if you eat a healthy diet, you will be good. This is what has been said here. And they were aware. Even in Bible, we have got the mention of the diet. So it's the science of diet is quite old as human civilization. Next slide. So coming to cholesterol business. Without life, and without cholesterol, life cannot exist. And life and cholesterol are intimately related. Whenever there is life, there is cholesterol. And normally, cholesterol is required for body synthesis of the tissues, repair of the tissues, hormone synthesis, memory, etc., etc. Now, if your cholesterol is high, it is associated with higher incidence of heart disease. So, we divide the cholesterol into 4 categories. One is called total cholesterol. Total cholesterol should not be more than 150 in the general population without heart disease. 150. Then comes bad cholesterol, also called LDL cholesterol, low density lipoprotein cholesterol, should not be more than 100 in the general population. For a person with diabetes, the LDL cholesterol should be less than 70. HDL cholesterol or good cholesterol should be more than 45 in ladies, more than 40 in gentlemen. Then comes ugly cholesterol, triglyceride, TG, should be less than 150 in the general population. Very, very important. Please do remember these figures because these are very, very important. I want to emphasize that all of you should have had 2 lipid profile by this age. One was 7 years, another was 17 years. And I believe all of you are above 17 years. Ideally speaking, you should have had 2 lipid profiles by this age. So then comes some newer forms like lipoprotein little a. We call them deadly cholesterol. So higher incidence is associated with heart attack. And the most important today is ApoB level. Higher ApoB is associated with higher incidence of heart attack. And this is a new thing in medical sciences. High ApoB is associated with higher incidence of heart attack. ApoB and ApoA ratio should be less than 1. Any figure 1 and above increases the chances of heart attack. Next slide. This is the map which I was referring to for cholesterol in India. You look into this that, Rajasthan more than 25%, Kerala 25%, West Bengal, Manipur, and this part of the West Bengal. See, all these are having more than 25%. This is the urban map, this is the rural map. So in urban population, most of the states have more than 25% incidence of cholesterol. Very, very frightening data. Next slide. This is the triglyceride or ugly cholesterol. This is the map. The entire India is, red. So triglyceride by and large is very high in our country. More than 25% of the population have high triglyceride level. Next slide, please. This is the bad cholesterol. See, sorry, good cholesterol. HDL is good cholesterol, low good cholesterol in entire country. Genetically, our population has less protection from heart disease because of this. This is genetically determined HDL or good cholesterol, HDL. And this is low in our country. Pan-India, you find this. Next slide. This is LDL cholesterol or bad cholesterol. Again, Kerala, Rajasthan, part of this Uttarakhand, Himachal Pradesh, surprisingly very, very high. We don't know the reason, but very high than West Bengal. So these are higher. And normal is, few states only. And northeastern states has, high LDL, which is lesser, as compared to rest of the population. But their triglyceride levels were higher. Probably it tallies with the rice-eating population in that area. Next slide. So diabetes, very, very important to know what is diabetes, because we are sitting in the diabetes capital of India. Again, this is a major public health problem. More than 11% population is diabetic. Next slide. This is the map, diabetes map. Urban map, you can see that more than 25% population has diabetes. So very, very high. Some form of diabetes is there. And 11.1% is the pan-India figure, but then, urban India has higher incidence. Next. Pre-diabetes, very, very high. What is pre-diabetes? Fasting sugar, 100 to 125 is pre-diabetes. Diabetes means fasting sugar is 126 and above, 126 and above. Pre-diabetes is fasting glucose, 100 to 125. See the population behavior, this frightening data. Next slide. Coming to BMI. BMI in Indians should be 22.9. 23 and above is overweight for Indians. And our population is having a peculiar type of obesity. We call it apple body configuration. That means they are otherwise fine, but the tummy is out. It's like an apple. We call it apple body configuration. And this is a very, very peculiar thing in Southeast Asia, and that makes the population prone to diabetes and cardiovascular diseases. So how do you calculate BMI? Weight in kg, height in square meter, divided by height square meter. Like 60 kg divided by 1.6 meter, again it divided by 1.6. What the figure you get is body mass index, but it is kg divided by square meter. So it should not be more than 22.9. 23 and above is obese for Indian population. Next slide. Generalized obesity. Again, see the country's data. So, most of the, 1/20th population, 20% of the population is already obese. Next slide. Abdominal obesity, entire population. Entire population has abdominal obesity. So I'm not making you frightened, but I'm just forewarning you. Please take care of your exercise program daily. Please take care what you eat. Carry your fruits to your college. Bring fruits every day. Please modify your diet, because this is adult population which is data showing. Next slide. What is the burden? This shows the population burden. You can see that high blood pressure, 315 million population. Cholesterol abnormality, 80% of the population has some kind of cholesterol abnormality. 400 million, 450 million is the population. So huge number. Next slide. So what you can do? Sodium restriction, exercise training, smoking cessation, reduction of risk factors such as cholesterol, diabetes and obesity. So healthy lifestyle gives you a longer life. Next slide. This is WHO model for a healthy diet, what you should do. Please look into this plate carefully. Fruits and vegetables are 50% of the plate. Protein 1/4, grains 1/4, and dairy products very small. So that should be every meal. We should consume meals like this. So please follow this kind of milk. Please propagate this. For your knowledge, the Indian population consumes more dairy products, particularly metros, particularly Delhi. Highest per capita consumption of milk and milk products. That is the reason why you get cholesterol abnormality in the population and abdominal obesity in our population. Next slide. This is a slide. It's a little complicated. By and large, what oil you should use, because I know some question will be asked later on, which oil is good oil. Olive oil is the best oil. Extra virgin olive oil should be used for dressing, and olive oil should be used for cooking. For our population, mustard oil is the second best oil, and mustard oil has been used for centuries in our country. So mustard oil is the next oil. Coconut oil is the most atherogenic oil. Coconut oil should not be used. Other, cold pressed canola oil or any oil which has not been hydrogenated, like vanaspati, like ghee, should not be used for cooking. Next slide. Exercise is very important. 30 minutes of brisk, moderate intensity exercise like strenuous activity, or at least 5 days a week, total 150 minutes per week, or 25 minutes like vigorous activity, 3 days a week, totaling 75 minutes, and high intensity stretching exercise should be there. Next. So stop smoking, reduce stress. Next. And the child is the father of man, says William Wordsworth. Next. Those children who had some kind of risk factor in childhood, they were followed up to 18 years. And see the incidence. Their incidence of diabetes up to at the age 23 years was higher, hypertension was higher, all the risk factors were higher. So you acquire in the old age, what you get at the young age, that you carry up to the old age. So you have to modify the behavior at the earliest part when it is possible, so that you prevent the heart disease in the population. Next. So this is the map showing the Indian population, particularly metros and Delhi. Obesity in India showing that very, very high incidence of pre-diabetes and obesity and overweight children in our country. Next. Now this is a conceptual diagram. What is the behavior of the risk factors and heart diseases? First, there is a genetic predisposition. Earliest thing, you get weight gain. Then you get high insulin level. At this juncture, you get high cholesterol level. Half of the population here gets high blood pressure. That continues, and after a certain period of time, you get a heart attack here, vascular, right? And by the time there is diabetes or something, then there is early diabetes, then late diabetes and complications. So heart attack occurs somewhere here. So you got really, 3 to 4 decades of your life for the prevention of heart diseases, because it goes high in a time-dependent manner. Next slide. Yoga is very, very important. Yoga is an ancient lifestyle, and we understand that yoga is just asana. Actually, it is not asana. It has 8 parts at Patanjali's Yoga Sutra, and these are the parts: Yama, Niyama, Asana, Pranayama, Pratyahara, Dharana, Dhyan, Samadhi. Basically, it is a pathway of self-realization, or to get absorption into the Supreme Being. And first principle is getting concentrated. That was the aim. And yoga was invented just to get God realization. And this only tells you that if you control your lifestyle, like the way you behave, the way you react, eat, exercise, if you control all these things, you can concentrate, and you can concentrate in your mind. You cut off from the afferent sources. So at a time you can increase your concentration to that extent that you can have self-realization. This was the aim. Now this is a full package for lifestyle modification. Right from, non-violence, truth, non-stealing, chastity, non-possession, that's the past part, cleanliness, contentment, austerity, study, devotion, asanas, the posture, control of breathing, withdrawal, concentration, and meditation and absorption. So if you follow all these paths, you will have a good life. Next slide. So when you should start prevention? You know, when I joined a corporate hospital, I learned one vocabulary: as soon as possible. Corporate, they write ASAP, ASAP, means you do right now. So your prevention should start right now. The way you behave, the way you interact, the way you eat should change. You should be opinion leader in the society, and if you're writing something, you should propagate this your knowledge of preventive cardiology to the society, and you can prevent the heart disease. Next. So together we can prevent heart disease, and this year's theme of World Heart Day, which is coming on 29th September, is don't miss a beat. Don't miss a beat. So that means you should take care of the heartbeat. You know, if you miss a beat, it is a arrhythmia, and arrhythmia is a harbinger of future cardiac arrest. So if you don't miss a beat, your heart beats nicely and you live for 100 years. Thank you.
Thank you so much, sir, for insightful and thought-provoking sessions. Do we have any questions here? Yes.
Mass communication. Show the signs of mass communication.
Prabhakar?
I should be bombarded with
Acha, okay.
Sir, if someone BMI is under control or HDL and triglyceride is above 130, can we control that triglyceride which has increased?
I got your point. Yes. So basically, see, first step for control of triglyceride is diet and exercise. You control the BMI first by exercise, regular exercise. Then next, eating plan should be very, very important for triglyceride. Don't do fasting. Please remember, gap between the meals should not be more than 2.5 hours. Every 2.5 hours, eat something. And don't take what is called refined carbohydrates like sucrose, like sugar, honey, or too much of carbohydrates loaded things like potatoes, rice, roti. These things causes high glycemic index. Suddenly the sugar goes high and the increased chances of high triglyceride. So if you reduce this in your diet, space the diet. That means 5 times eating plan, 3 major meals, 2 snacks. That should be there. Small, frequent meals. So if you do that, then the triglyceride goes down.
Sir, later it will reduce our more weight than what we can do.
Sorry?
If we will control our diet, as you mentioned, it will reduce our weight. What we will do then?
Oh, no. See, diet control will not reduce your weight. See, calorie restriction will. You must understand between 2 things. Quality of diet, which we are talking today, and the calorie restriction. Weight loss will occur if you restrict the calories. Have sources of calories from complex carbohydrates. Complex carbohydrates like bajra, jawar, like that. Right? These are complex carbohydrates. Don't take sugary things. Don't overload with high calorie sweeteners. Don't take cold drinks. But instead of that, take a fruit portion. That will give you the same calorie, but higher glycemic load, higher glucose load to the system. Do you get my point? Food exchange should be used. Food exchange. Calorie should be same, but change the quality of the food. Right? You must understand this. This is very important conceptual question. Thank you for this question.
Okay.
Yes, please, lady there. You can share, tell, yeah, please. Yeah.
मैं इसी के यहाँ पे पूछूंगा सब.
Okay. So BMI is one part of the game puzzle. Please do remember why it happened in that particular case, we don't know. These are assumptions and hypotheses. Coronary artery disease largely occurs because of conglomeration risk factors. His BMI might have been normal, even low, but then here LDL cholesterol could be 200. You don't know. Maybe he was smoking 10 cigarettes a day. We don't know. Yeah.
Please explain sleep apnea, because most of us, they are not aware about this term, that like in रात को हम जब सोते हैं और कई बार हमारी सांसें रुक जाती है, and we are not aware about that, and that also leads to the cardiac arrest. Or so could you please explain it in
Normally, little bit of snoring is normal, right? But if you are snoring and sleeping, which disturbs your partner, that's one sign. Or if you are yourself, you are awaking, you are just sitting up suddenly at night, so this is a warning sign. Or if you are having a sleep, you came to the class or you are in a lecture theater, suddenly you are dozing off, right? Or while driving, you doze off. That means that snoring is the cause, a very important cause. Snorers have higher incidence of high blood pressure, diabetes and metabolic diseases. They have higher incidence of sudden death, coronary artery disease, heart failure, stroke, everything. So recognition of the snorers is important, and when you are snoring, then you should take care of your body weight first. Lose weight by 10%. And after that, if you are not able to get rid of it, see a doctor. He will advise you, because there are a lot of things to be investigated. They do the sleep study, and after sleep study, they will categorize you whether you need some intervention or not.
Okay.
Yes.
So we have a question from a center. We'll take the question later. So there is this question from Astha Singh. She's from IMC Jammu campus, and she's asking, how can I determine if I have hypertension, and what are the common symptoms or signs that may indicate high blood pressure?
So very good question. See, hypertension is called silent killer. It does not have any symptom. Please do remember, hypertension is a silent killer. If you have symptoms of hypertension, they are like you are getting headache, or you are getting palpitation, or you are getting chest pain, or you are getting breathlessness. These are all. Or you have a paralytic attack already. You have missed the train. Already it is advanced stage because the complications of hypertension has occurred. So I showed in the slides that the normal blood pressure is less than 120 and less than 70. I repeat, less than 120 and less than 70. 120 to 139 is elevated blood pressure. 71 to 89 is elevated blood pressure. 140 and 90 and above is high blood pressure.
Okay, sir. So,
सर कोविड-19 के बाद सर कोविड-19 के बाद हार्ट अटैक के केसेस काफ़ी आए थे, न्यूज़ में भी देखा हम लोगों ने. तो सर इज़ इट ट्रू कि कोविड-19 के बाद कार्डियक प्रॉब्लम ज़्यादा शुरू हो गई?
देखिए, कोविड-19 से पहले भी एवरी विंटर हार्ट अटैक ज़्यादा होता है. ठीक है, एवरी विंटर. ये जो कमिंग विंटर आ रहा है, तभी भी हार्ट अटैक ज़्यादा होगा. जब भी वायरल एपिडेमिक होता है सोसाइटी में, बढ़ जाता है. न्यूमोनिया होता है, वायरल न्यूमोनिया, वायरल डिजीज. इन्फ्लुएंजा भी होता है. इन्फ्लुएंजा पैंडेमिक के टाइम भी हार्ट अटैक बढ़ जाता है. तो इट्स नॉट कोविड रिलेटेड. एनी इन्फ्लामेशन इन द सोसाइटी causes heightened risk of heart attacks. It is not because of anything. It is a normal response of the immune system. Because see, heart attack is an inflammatory disorder. And if you see post-COVID, काफ़ी लोगों में हाई सेंसिटिविटी सीआरपी बढ़ गया है, ईएसआर हाई है, वो नॉर्मल रिस्पॉन्स है टू द वायरल प्रोटीन. वेदर यू हैव had COVID-19, whether you didn't have COVID-19, whether you are vaccinated, unvaccinated, irrespective of that, because that antigen was circulating in the population and in the areas. You know, you have inhaled the antigen, it has gone to your body, so immune system का activity बढ़ गया. As a result, there is increased heightened activity, inflammation. थोड़ा inflammation बढ़ेगा ही बढ़ेगा, ये हर viral disease के टाइम बढ़ता है. तो अभी आपको कैसे ज़्यादा पता चल रहा है? ये तो इंटरनेट की जुग जमाना है, आप ही लोगों का जमाना है, मास कम्युनिकेशन का. सो यू हैव इंटरनेट, यू हैव ऑल द सोशल मीडिया, सो एवरीथिंग इज हाईलाइटेड. पहले भी होता था, पहले पता नहीं चलता था, इतना डिस्कशन नहीं होता था, अभी ज्यादा डिस्कशन हो रहा है.
Hello, sir.
Just a second. He's been asking from a very long time. Yes. Him.
प्लीज.
He's been asking.
ठीक है.
First of all, good evening, sir. My name is Abhishek, and I'm asking this question on the behalf of my whole class and on the whole auditorium. So, as a student, we have a lot of problem. Like, we have exam stress. We are always wake up late night. We are solving the assignments, lot of things. And in this very unbalanced life, how can we maintain our heart? Like, how can we protect our heart?
See, in a single word, follow the last slide I showed in yoga. I showed you Patanjali's Ashtanga Yoga. As a student, please go through this because it will be treasure for your life. Patanjali's Yoga Sutra gives everything. So in nutshell, I must tell you, control of your diet, having a regular routine sleep and exercise pattern, eating regularly in a timely manner, and having consistency. Sleeping 7 hours a day. Avoidance of smoking, alcohol, and late nights. This will give you good quality life. Exercise program should be a routine for all of you. And what you incalculate today, you will carry up to 80 years of age. If you cannot modify your behavior today, if you don't find time today, you will never find. Because most of you are not married, don't have family, no responsibility. So you can modify your lifestyle right now. Whatever you do today, you'll carry. So as I told you, modify the lifestyle. About the stress, see, without stress, you cannot be achievers. Just because you are sitting here tells me that you are under stress. Unless you had stress, you won't have performed, you won't be sitting here.
So, am I audible?
Yes, yes.
सर मेरा क्वेश्चन ये है कि इन केस हमारे सामने किसी को कार्डियक अरेस्ट वगैरह आ रहा है तो हम उस टाइम एट दी पर्टिकुलर टाइम हम क्या हेल्प कर सकते हैं क्योंकि
जी सो ये अहम सवाल है, बहुत इंपॉर्टेंट है. आई थिंक मैडम विल अरेंज फॉर ए सीपीआर क्लास someday. We should do CPR called cardiopulmonary resuscitation. Please Google it. American College of Cardiology has a CPR training session videos. So largely मैं बता देता हूँ कि जब भी वो गिर गए, मान लो मैं गिर गया, तो आपको क्या करना है? दौड़ के आना है मेरे सामने, आके पूछना है, hello, are you all right? If I am not responding, check my carotids. There is no flow, start thumping here.
सर काफी बार सर गैस अटैक आता है और कार्डियक अरेस्ट है, तो उसमें फर्क कैसे पता चलता?
क्या चीज?
गैस अटैक.
गैस हो जाता है. गैस इज द ग्रेटेस्ट मस्करेडर. दिस इज अ प्रॉब्लम इन आवर कंट्री. एवरीथिंग वी हैव वी से गैस हो गया. दिस इज अ प्रॉब्लम. दिस इज द कॉमनेस्ट कॉज ऑफ मिसिंग हार्ट अटैक्स इन आवर कंट्री. दिल्ली में हो रहा है, चारों तरफ इतना अस्पताल है, फिर भी हो रहा है. सो See, please remember, gas की मैं बता देता हूँ, rule of 15. Please remember, become an opinion leader in your society. If there is pain in the abdomen, could be gas, fine. Take 15 minutes of liquid antacid, 15 ml, 3 चम्मच डाइजिन दे दीजिए. ठीक है? किसी का पेन यहाँ हुआ, गैस का पेन बोल रहे हैं, घर में मान लो दादाजी कह रहे हैं कि गैस का पेन है बेटा मेरा, तो डाइजिन लिक्विड 15 ml दे दीजिए, 15 मिनट वेट करिए. 15 ml liquid antacid, wait for 15 minutes. If the pain does not subside, it is not gas. Get ECG done. Rule of 15. Because please remember, first hour is the golden hour. You can play with the first 15 minutes because you'll have to rush him to the nearest hospital where ECG can be done, interpreted and appropriate treatment can be started. Thank you.
Sir,
One of these
symptoms-
girls
okay.
from, enough. One of these girls from ADPR. Yeah.
Sir, you told us about how to lose weight, but how do we gain weight? Like for people like me who are really thin.
You're mistaken. I have never said you lose weight. I said
No, like you
maintain
mentioned.
body mass index. Now, if you want to gain weight, increase the calorie intake, increase your muscle mass. Do regular physical activity. Those people, they want to gain weight. Don't think that inactivity or sitting idly will make you fat. No, it won't. You have to increase your muscle mass by regular physical activity, physical training. Eat little higher calorie than your recommended calorie. That normally, how do you calculate calorie? You must understand. If your normal weight 25 into the body weight. So that is the calorie requirement. If you are underweight, 30 should be there, right? 30 into weight. And if you are overweight, you should reduce the calorie. If you are underweight, increase the calorie intake by multiplying that body weight.
Sir, how to deal with hypotension?
Hypotension is a boon actually, it is not a disease. Normally the blood pressure is normally, 90 by, like in your age, your blood pressure will be 90 by 60, which is normal. You get some weakness, you say, oh, mera blood pressure kam ho gaya. No, this is a boon. Keep it like this. Drink enough water, that's it, full stop.
But sir, it makes me feel sleepy. Hypotension.
No. See, if you are feeling low, have a coffee. To increase your blood pressure should never be aim. Lower blood pressure is a boon from Almighty. You live for 100 years if you have blood pressure of 90. The only problem will start, you start increasing your blood pressure gradually as the age advances.
And sir, another question is, can anxiety and depression is a cause of facial paralysis?
For facial paralysis, no. Facial paralysis is a, viral disease.
Hello, sir. I'm Sakshi from Department of Strategic Communication. You mentioned in your presentation that we should not use ghee in our cooking. In fact, most of us think that ghee is the best option. So why ghee is not recommended when it comes to heart health?
See, we don't say that don't take ghee. What we say, take in moderation. Our problem is that we don't understand what the ghee is. Please remember, while preparing the ghee, it has already been heated to more than 200 degrees centigrade. It has been desiccated. There is no water in it. And now, Indian type of cooking is, you make it very hot pan and then give ghee, and then when it is, there's smoke, then you pour the vegetable there. That's what you do. That destroys the ghee. So, we say that don't use ghee for cooking, right? You can do only saute. If you are eating with a just little fried vegetable eating, then it's allowed, otherwise no. Now second cultural practice is pour ghee on the roti, right? So I actually learned something, I'll tell you a story, 1 minute liner, because I was posted, from Fortis, Vasant, Kunj, I went to Paras Hospital as a director of cardiology, and I learned that, most of the people are coming from Haryana, rural Haryana background. And one day I told one gentleman, please don't take ghee. And he became mad. Then one of my doctors explained, don't tell that don't take ghee. In rural Haryana, if you cannot take ghee with the roti, that means you are a very poor guy. So the patient is understanding, do you think that I am so poor I can't afford ghee? So ghee on the roti is a cultural practice for years. So what you do, as a cardiologist, what I do, I always tell one thing, please don't use solid ghee. But the culture is put a solid ghee, chunk, right? This has to be stopped. First thing is liquefy, right? So 1 teaspoonful, that white ghee becomes, 10 ml, right? 5 becomes 10. So from there, take half of it, take 2 rotis, little drop and then, rub together, then you can have it. So you're taking ghee, little amount without heating at a higher temperature. Right? Or you have cooked any dish, right? And you want that it should be smell of ghee. Give 5 ml liquid ghee on the top and garnish it and serve it. But my problem is that you're taking ghee, because Dadaji used to take pav bhar ghee, main pee jata tha. Yes, I learned. Yes.
Good evening, sir. As we are living outside from our home and we are consuming chai, samosa, junk foods on the daily basis from our canteen. So what could be our replacement diet?
If you make me the director of food safety first thing I'm going to stop is bread pakora and samosa, banned in India. Now you may ask me why doctor? Because see, the problem is not ghee, problem is not the samosa or bread pakora. The problem is, since when this oil is being reheated? 5 years, he has not thrown. Same big karai and doing the same thing, adding some oil. So reheating oil causes hydrogenation of the double bonds and causes increased formation of free radicals. And trans fat becomes more than 1%. Right? Trans fat. So the trans fat is toxic to the body. So if you are making samosa and throwing out the oil today, tomorrow being another tin full oil and then make new samosa, I am fine with it. You have to throw the oil.
Hello sir, my name is Ashutosh. Actually I am facing cyclic migraine from past 7 years. During my migraine, I am feeling like my heartbeat goes so fast. And उस टाइम पे ऐसा लगता है सर कि जैसे कि मतलब मुझे माइग्रेन के साथ साथ हार्ट अटैक भी अभी आ जाएगा. और सर ये करीब 7 साल से मेरे साथ लगातार हो रहा है. और इस वजह से जब भी मैं उस टाइम पे होता तो मैं महीने भर 1.5-2 महीने तक सही से सो भी नहीं पाता हूँ. कभी भी उठ जग जाता हूँ उठ के एकदम, जैसा कि आपने बताया हाइपरटेंशन में वगैरह में ये सबसे पहले सिम्टम्स होते हैं. तो सर माइग्रेन की तो जो मेरा इलाज चल रहा सो चल ही रहा है, क्या ये हार्ट रिलेटेड भी प्रॉब्लम्स क्रिएट कर रहा है मेरे लिए?
Any pain will increase your heart rate and blood pressure. Any pain anywhere in the body. Maybe physical pain, maybe mental pain. Please do remember, pain increases heart rate, pain increases blood pressure. So same thing is happening to you. So should prevent the migraine by taking the medicines prescribed your doctor. So this will reduce. उससे कम हो जाएगा आपका. Secondly, you can prevent the second arrow. Lord Buddha said, I can only give cure for the second arrow. What is the first arrow? First arrow is the pain which the world throws to it. Like आपने मुझे कुछ bad words बोल दिया. This is the first arrow. My reaction is the second arrow, which I throw to me. Right? That I can modify. Right? If you start thinking from today, सर दर्द जो हो रहा है ना, ये हेड को हो रहा है, मुझे नहीं हो रहा है. आपका सर दर्द नहीं हो रहा है, हेड को हो रहा है. पेट में जो दर्द हो रहा है मुझे नहीं हो रहा है, पेट का हो रहा है. थोड़ी देर ठीक हो जाएगा. मैंने पानी पी लिया, ठीक हो जाएगा. डॉक्टर की दवाई ले लिया, ठीक हो जाएगा. दिस कंसेप्ट इज वेरी वेरी इंपॉर्टेंट, विच आई गिव यू. आई एम टेलिंग यू, आई एम कोटिंग फ्रॉम वेदांतिक लिटरेचर. दिस इज कॉल्ड विथड्रॉल ऑफ द माइंड. Body suffering, you are not suffering. If you think in that way, it will give reduced pain to you.
Thank you, sir.
Okay. So just one last question from Amravati campus.
Yeah.
This is from Arfa Hussain. We have been seeing a trend of badminton players having heart attacks on court while playing. So is physical activity not enough as a preventive measure?
No, not only badminton players, many players, football players also have died, people doing treadmill has died, so any physical activity may increase the chances of heart attack. Now, the important is prevention. How do you prevent? क्या करना चाहिए आपको? देखो, first rule, if you had bad night, that means if you had a bad quality sleep, don't do exercise in the morning, first thing. Secondly, if you had alcoholic binge, no exercise in the morning. Third, hydrate yourself. Fourth, if you are having any physical illness or mental illness, don't do exercise on that day. You should be in a good form of mind and body to perform exercise. And next, most important, that before taking into exercise or playing, you should have had a thorough checkup by your physician, like diabetes, hypertension, cholesterol should have been, ruled out or taken care. And other important thing, particularly to the people who are going to gyms, don't take the supplements, dietary supplements supplied by the gym instructors. Please don't do, because they contain a lot of chemicals which are bad for the heart and the kidney. They sell this. They give phosphofructokinase and they sell the products. So don't take that. Do exercise, do training with them, but don't take the food which they are selling, because that contains a lot of additives.
Thank you, sir. Now I will request Dr. Meeta Ujjain, Course Director ADPR, to propose the vote of thanks.
Thank you, Yashaswika. I think I'm really to see that there is one line, don't miss the beat. That is the main core of this whole lecture. We are really grateful to Dr. Tapan Ghose, who has given such a nice, not just a presentation, but he actually made us aware about what are the green flags or red flags of our heart health. That is very important. The second thing which really surprised me, that students, the way they have interacted with Dr. Tapan is really it's overwhelming, because nowadays students, though they are so much in stress and busy, they are overburdened with the assignments, I understand, but okay, you have to learn that how to manage those things with your lifestyle. The best part of today's session was that sir has continuously pointed out on various aspects like sleeping, exercise, good diet, and good mental and physical condition. That is very important. Even I am surprised to have his the last line which you have just said, that if you are in a bad mental health or physical health, don't go for exercise. What we usually do is that whenever we feel low, we think, okay, tomorrow we will have a crunches, or tomorrow we will have we will do sit-ups, or we will go for brisk walk, which is not healthy for us. Sir, on behalf of IMC, I am Dr. Meeta Ujjain. As you know, that I am really grateful, and that you had actually given us the time that which was very important for us, and I'm really thankful to you that you have joined us. And on behalf of IMC and IMC Administrative Department especially, we should be thankful to our Vice Chancellor, Dr. Pragya Paliwal, who has given this who allowed us to organize this particular health talk, and we are really grateful for Fortis team that they have done from since morning. They all are busy in health checkup, and IMC administration, our states team, our outreach team, Yashaswika, Archana and Aditya and all, they all have really worked hard to make this program successful. And I should be thankful to all our regional center students and RDs and all my students who really participated in this discussion, so that most of the question we have missed out due to the lack of time, but still we will start. This is the first thing which we have started, and we will continue with all these kinds of exercise in the near future. Thank you so much, sir. Thank you so much.